you would be the panelists, to the delegates attending as well, and that includes supporters of the cause, supporters of the fund itself, people who have bought into this important vision of providing relief to the thousands of people impacted by COVID-19 in terms of life and livelihood, and as well a greeting, welcome to members of the media. You have this very important role in asking the questions that the public needs to know, and then you amplify those questions. So in this case, the work of the Solidarity Fund, and certainly in this case, the people who do not know has a right to know, and you play that very, very important role. And when I say welcome, in terms of the event itself, it's an important briefing that you need to be a part of. It's called the Solidarity Fund Interim Impact Report briefing. I'll repeat that, the Solidarity Fund Interim Impact Report briefing. So welcome indeed to each of you. I want to just introduce the panelists very, very quickly, and then we'll get to some of the important conversations. And yes, the media would be asking questions later on, right? Amongst the panelists then, and let's say no batting orders specifically, Gloria Sorobe is the Solidarity Fund chairperson. Gloria, welcome, and thank you for joining us. Maybe a good thumbs up would certainly do. Thank you. And then we have Thandi Nzimande, who's the newly appointed CEO, just there for a month, in fact, of the Solidarity Fund. Thandi, thank you for your time. A thumbs up to you. And from you, of course, Jonathan Broomberg is the Health Pillar Executive. Jonathan, thank you for your time. Thumbs up to you as well. Nicola Golumbik, who's, I believe, in London right now, Head of Disbursements and Deployment. Nicola, appreciate your time as well, and thank you. And then finally, Adrian Anthoven, who's the Solidarity Fund Deputy Chairman, or Deputy Chairperson in this case. Adrian, appreciate your time, and a thumbs up to you. Right. So that's the short welcomes, and the plan is really to keep it very tight. Let me introduce myself. My name is Ashraf Garda. I'm the founder, the chief driver of Champion South Africa. We have a vision to build South Africa into a champion nation. And that is why I think it's particularly important that I'm here, because it is in that context that everything, both South Africans individually and institutions, need to be aligned to what I call a champion DNA, so that we get things right, whether it's proactive or whether it's responding. We need to get all of that right. And in that case, I think in terms of the national cause, starting from government to the Minister of Health, into that very important grouping that has made important decisions around COVID-19, and to all of us, of course. So I think it's an important task that we are part of. I would lovingly borrow that phrase from the Springboks, stronger together, and if there's nothing else, we need to be aligned to that. So a privilege certainly for me to be here as your facilitator, amplifying the work, in this case, of the Solidarity Fund itself. Okay, let's then get straight to where we need to go. So we're going to have the people I've introduced and not too long, some of them a few minutes, some others longer than a few minutes, and then thereafter we would have questions from the media. So thank you for your time. Right, there's also, so the media plan, just so that you know, we would allow you to get your videos on, and then we can talk to you, and you can question the CEO firstly, or the relevant person directly. There's also a capacity for you to send text questions too, and there's certainly a capability for you to ask for the rest of the delegates, in fact, people who have vested interest in the workings of the organization, to ask questions and comment via that all-important chat line as well. So before we go to it, let's get this. If yesterday speaking about the Solidarity Fund was important, but if understandably in the last month there was a sense of complacency to say, well, maybe they... That, as we know, has indeed changed. The Minister of Health, Zweli Mkhize, pronouncing yesterday that we are now officially in a second wave, and giving us numbers, talking about 6,700 infections yesterday alone, and talking about that positivity rate ratio around 18%. To put that into perspective, as someone myself who was COVID positive on the 1st of July, when I was, the positivity rate was around 30%. Infections soared to 15,000 a day in that period. It then dropped down to, as we know, low as 1,000, 1,200 people a day, and the positivity ratio rate, testing ratio rate dropped to around 8%, where it has stayed for the last 3 months or so. That, as we know, has indeed changed. And therefore, at this point, that I pray not all of us will be COVID infected, but what we cannot deny is that every one of us, myself and you, present, past and future, will be COVID affected. So we're not all COVID infected, we definitely are COVID affected, and therefore the work of the Solidarity Fund, I think, is particularly important in terms of how they can, in their own way, alleviate some of the problems for the masses of our country who are, in some way or the other, very, very much COVID affected. So, first of the speakers, then Gloria Sarovic, who's the Solidarity Fund chairperson. Gloria, thank you for your time, and you will deliver this all-important but short welcome address. I'll leave it over to you.
Thank you very much, Ashraf. Good morning, everyone, and welcome to what we would say is our 2020 report. We wish we could say it's the last report, but as Ashraf says, the Solidarity Fund is needed for a little bit more because the COVID is just refusing to go. So let's see this as a 2020 report, and we will talk about going forward, and Ed will cover that. Let me start off by saying that on behalf of the board of the Solidarity Fund and its team of over 200 volunteers, please accept this report as our humble effort to chronicle the 6 months journey up to end of September and its history from 23rd of March when the Solidarity Fund was established. The main task and focus of the fund was to manage and augment the work of government, and it took urgent and drastic measures to curtail the effects of the local COVID-19 epidemic to protect the people of South Africa. We may have forgotten that the first known case of COVID-19 was reported in the world was on 17 November 2019 in China. Sounds like a long time ago, but it's hardly a year that the first case of COVID was reported. 3 months later, on the 11th of March 2020, WHO declared the COVID-19 outbreak a global pandemic. Having observed the devastating effects all over the world, especially in Spain and Italy, almost no country was spared. By then, South Africa, a week earlier, had experienced its own first known case of COVID-19 on the 5th of March. And 10 days later, on the 15th of March, President declared a national state of disaster in terms of the Disaster Management Act. And then on the 23rd of March, President declared the first lockdown of the country, effective 27th of March 2020. He also, in that announcement, formally announced the establishment of the Solidarity Fund under the chairmanship of myself and A.D. Eindhoven as the deputy chairman. This decisive response of the South African government was nothing short of amazing and applauded by the WHO. As an independently run rapid response vehicle created to respond to the COVID-19 epidemic in South Africa, the Solidarity Fund became that platform where both South Africans from all over the world and also our international friends and relations and donors could express their support to fight the pandemic on our behalf. The response was overwhelming. The generosity of spirit, time, and the financial donations given to the fund allowed the fund to lessen the impact of the pandemic as effectively as possible. Over 3 billion rands in financial contributions from so many people, over 300,000 people, 14,000 individuals, over 2,500 corporates, was the generous response of South Africans and our international allies. We also received an overwhelming response of donations in kind and human resources support. An example of an in-kind donation we received was when, for example, Transnet converted their 2 Pelopepper community health train into testing trains to help provide testing capacity in remote and far-flung towns, accessible only via existing railway trains. This kind of support was priceless, and this was evidence of the greatest leap of faith and hope given to a fund which really had no previous track record. It remained, though, for us as leaders to make sure that the South African public and those who supported us could be assured of the fact that their money would be directed to exactly where it was intended. With that in mind, a strong, independent, and experienced board of directors from business, from government, and civil society had to be appointed to oversee this fund. I am particularly grateful, and I would like to express my greatest gratitude to Sizwe Nxasana, Ayanda Nsaluba, Trifosa Ramano, Michael Katz, Tulani Chefutsa, Kumutsu Makupola, Minister Patel, and Minister Mboweni for agreeing to join the board and help us oversee the function with the greatest support and assistance from Martin Kingston. In terms of our responses, given that COVID-19 did not discriminate rich and poor, urban and rural, townships and suburbs, our tactical response to each of these communities had to be extremely innovative, especially given the lack of infrastructure in some parts of the country. It is fair to say we managed to the best of our abilities to be inclusive in all our solutions. The journey of the Solidarity Fund has been one of common purpose and unity, challenges, humility, pride, and hope. As a team, we constantly pushed each other's boundaries in our quest for excellence. The strong leadership displayed by the Interim Chief Executive Officer Nomkita Ngweni, and now followed by Thandi Nzimande, provided the firm foundation needed to expedite the many facets required within the fund, with integrity, good corporate governance, and exceptional delivery. And thank you to all who gave their best and continue to work tirelessly to protect our country from the dire effects of COVID-19 and to raise her up as a stronger and more unified land. With that, I would really like to hand over to Thandi Nzimande, the CEO, to take us to the detail of the fund. Thank you very much, Ashraf.
Thanks for that. Thanks for that, Gloria. And I think it's an important scene setter in terms of where we are, but very importantly, where we need to go. I'm pretty sure, certainly in the light of monies that have come in, monies that have been allocated, and that difference between the two, and very importantly, in terms of the what now factor, in the light of us going through the second wave, I would assume that certainly besides information, definitely media would want to ask some very important questions about that, and we need to talk about it. But that comes up later on, right? Let me then bring in Thandi Nzimande, who's the CEO of the Solidarity Fund. Thandi was appointed about a month ago, so it's an absolutely new position for you, but it doesn't stop you from delivering an all-important keynote address, and also talking about the overall impact, and then that very important issue around the vaccine. So Thandi, over to you.
Thank you, Ashraf. Good morning, everyone. It's good to be with you all here today. Excuse me. Frog in my throat straight away. When I joined the Solidarity Fund at the beginning of November, I can't say that I didn't know what to expect, but I was still overwhelmed, and I'm still inspired by the mammoth task that the fund faces. Most organizations of this magnitude get to evolve as they grow over time. With the fund, a pro bono workforce of over 200 colleagues, as Gloria mentioned, over this period worked together to build a 3.1 billion organization within a very short space of time, one that has delivered tangible impact for South Africans. I am incredibly proud to be a part of this team that makes the seemingly impossible happen on a daily basis. To quote our former interim CEO, Nomkhita Ngweni, the fund showcases the art of the possible. And I have certainly seen that and experienced it here. As Gloria already pointed out, one of our primary objectives in managing the fund is to ensure that South Africans, donors, and partners can be confident that the funds were being directed in a responsible, accountable, and effective way. Part of that is reporting back extensively and openly on the work that we are doing. We are accountable to South Africa. With that in mind, the publication of the Interim Impact Report documents the fund's story and achievements and the impact that the fund has had in the first 6 months of its existence across the 3 pillars of health, humanitarian relief, and behavioral change. The period in focus today is from the inception of the fund to the end of September 2020. We will be touching also a little bit on the next phase of the fund. But before we take you through to the detail, I would like to address the issue of vaccines and the role that the fund is playing in supporting government's efforts to secure vaccines for the country. As Ashraf said, that's a point of interest for most South Africans. At the fund, we all share the world's excitement, hope, and sense of optimism now that the first vaccines are starting to be trialed around the world. As we all know, an effective vaccine is the cornerstone in the global fight against COVID-19 and essential if we are to learn how to live with the virus in the long term. The Solidarity Fund is proud to be in a position to support government's efforts to accelerate the rollout of vaccines in South Africa with a donation of 327 million rand to secure the country's position in the COVAX program. This particular donation is earmarked for the upfront payment required for South Africa to join the program and represents 15% of the total cost of securing access to vaccines for 10% of the population. That would be roughly 6 million people. The fund was set up as an agile, rapid response vehicle to unite the country in support of the national effort to combat COVID-19. The speedy rollout of a comprehensive vaccine program is vital to end the devastation that COVID-19 has brought on people and the economy. COVAX is a crucial part of this program, and therefore there can be no greater service that the fund can do for the people of South Africa than to play our part in ensuring that we receive our equitable share when the vaccines become available. In the meantime, there is still a lot of work to be done. Thanks to the generosity of donors from individuals, ordinary South Africans who reached into their pockets, to business, to NGOs and international supporters, the fund has been given a clear mandate to use the donations wisely, effectively, and responsibly to help fight the pandemic. When President Ramaphosa launched the Solidarity Fund with 150 million donation from government, the ensuing response from business and individuals was rapid and inspiring. To date, the fund has received 3.1 billion in financial contributions from over 304,000 donors, including 14,487 individuals, 2,523 corporates, and from international donors. Since Gloria touched on the the aspect of individuals donating throughout the country. We also received an overwhelming response of in-kind donations and human resource support. An example of an in-kind donation we received, for instance, was when Transnet converted their 2 Pillow Pepper community health trains into testing stations. This kind of support was priceless and was evidence of the greatest leap of faith and hope in a fund that had no previous track record. The fund's work is really defined by 3 pillars: the health response, aimed at supporting urgent aspects of the health system response and supporting and protecting frontline health workers; the humanitarian effort, aimed at providing humanitarian support to the most vulnerable households and communities; the solidarity campaign. Under the behavioral change pillar, which is aimed at uniting the nation in action against COVID-19, and critically encouraging behavior change in communities across the country. In terms of the allocation of funds during our first 6 months across the 3 pillars, we roughly targeted the following proportional breakdown. As you can see on the screens, that is, the health response was targeted around 70 to 75%, the humanitarian efforts 20 to 25%, the behavioral change in the form of the solidarity campaign 5 to 10%. These are rough indications. They're not necessarily where we landed, but they give directionality as to the effort that was placed. The following allocations and disbursements were made actually during the period. This does get a bit number heavy in this section, but these numbers are all in the report. So under the health response, PPE was the leader by far of all allocations and disbursements, as indicated by the need at the time. The amount allocated was 884 million rand, and the amount dispersed for PPE was 703 million by the end of September. Testing was allocated 409 million rand, with 334 million rand dispersed. Essential equipment was allocated 405 million rand, and really that has largely been dispersed in the second phase. And ventilators, the allocation there was 282 million rand, and the amounts dispersed were 119 million rand. Johnny will be speaking to the health response in a bit more detail, so I'll just keep it to the high-level numbers. On the humanitarian effort, in respect of food relief, 320 million rand was allocated, and by the end of September, 117 million was dispersed. Gender-based violence, 92 million allocated and 12 million dispersed by the end of September. Behavioral change, the solidarity campaign, 61 million was allocated and 35 million dispersed by the end of September. We will delve into each pillar in a moment with Johnny and Nicola's assistance. We note that many of these programs are ongoing, so what wasn't dispersed by the end of September continues, in fact, to be dispersed now and into the future. At its heart, the Solidarity Fund aims to be a part of and drive a coordinated effort in response to the COVID-19 pandemic in South Africa. A key founding principle is that of additionality. where the fund has contributed towards extra good that would not have been achieved in the absence of its investment, efforts, and coordination. This principle of additionality finds direct expression in the nature and number of partnerships the fund has formed and deepened since its inception. If there is one lesson that seems to apply across all projects and all pillars, it is the importance of meaningful, cooperative partnerships. Without them, what has been achieved would have been impossible. A big thank you goes out to all who have assisted us in our first 6 months and who continue to assist us too going forward. You are too many to name, unfortunately, but not too many to remember. Thank you very much for your assistance. I would like to make a special mention of our colleague, Wendy Clow, the current head of the humanitarian and behavioral change pillars. Wendy, even though you are unable to join us today due to bereavement, we honor your work. Nicola Galambik, a colleague who has been there from the very inception. I think probably if there were boxes to have been brought in, she would have been bringing them in. Will present on your behalf. Nicola, as Ashraf introduced, holds the position of the head of disbursements and deployments, and generally very hands-on in many respects. And thank you, Nicola, for stepping up to present on the humanitarian and behavioral change pillars. We will now take a closer look at the health pillar. So I will hand back to, do I hand back to you, Ashraf? And then Johnny will take it. You're muted. Ashraf, you're muted. Ashraf?
Yes, you've handed back to me, and that's absolutely fine. Thank you for that, Thandi. I think what's very clear, just without getting into the numbers, I think your level of enthusiasm, your commitment on behalf of the board that you represent, and your commitment to the country in terms of delivering on this course, even in the short period that you've been there, I think is very, very evident. And we pray that this philosophy of stepping up continues, not just from yourself, but for the entire team here, and for all of us on the outside looking in, because we shouldn't be looking in. We need to embrace this and deliver on this to ensure that we as South Africa can meet very, very important targets in terms of our response around COVID-19. So thank you for that, Thandi. Now, as has been mentioned, Jonathan Broomberg will have specific, maybe deep dives down into issues around health. He's the executive for the health pillar. And Jonathan, if you can deliver then the health report. So Jonathan Broomberg for 10 minutes on the health report.
Thanks very much, Ashraf, and good morning, ladies and gentlemen. It's a pleasure to be with you this morning. I think I don't need to remind us all about the appalling tragedy of this global pandemic and its impact on our own country. But we feel in the fund that it's important to recognize at the same time that we have created lasting legacies that we can be proud of. A strong and very powerful collaboration across business and civil society with government, an incredible range of volunteerism that has come together. And in the health space, one of the the key impacts of this legacy is that as of today, and partly as a result of the work of the fund, but also so many other organizations and people, you know, we can see that our health system, both public and private, have coped admirably with the clinical burden of COVID-19. Our hospitals have adequate PPE. The country has sufficient testing capacity, and really our doctors and healthcare workers and hospitals have coped remarkably well. And our fatality rates are very well in line with the best in the world. And this is something as a country we should feel very proud of. It is, as I said, the result of very strong and effective partnerships. And one of those that's been absolutely fundamental for the Solidarity Fund has been a strong partnership with the Department of Health. Each proposal that's ultimately been funded by the fund has resulted from either directly from the department or, for example, from a state-owned entity like the National Health Laboratory Service, or has been in very close collaboration with the department itself. So I think you're aware of, and Thandi has mentioned, the broad categories of what the fund has supported. Again, the details are in the report, which is available to you, but I will attempt to briefly summarize these. A very large initial focus was on testing, clearly critical to allow the country to test, all those suspected of infection and to do contact tracing. The fund allocated 409 million to bolster national testing capacity. As of the end of September, about 335 million had already been dispersed, and the rest of that is being dispersed at the moment. And this had significant impact on the ability of the National Health Laboratory Service to cope with what was a huge surge in demand in the early months, as many of you will recall. Total of 1.2 million kits were purchased by the fund to support the National Health Laboratory Service. We also worked hand in hand with the South African Medical Research Council to stand up virology laboratory capacity at 7 universities and 3 labs in previously disadvantaged universities to further increase testing capacity, as well as supporting a community-focused testing initiative with the Association of Independent Community Pharmacies. So a large number of tests were done. The labs were stood up, and fundamentally we were able to bridge a gap at a point when that was really critically needed. A second big focus was supporting the delivery of care in the public hospital system, which, as you know, at the time we were all very concerned about the ability of that system to withstand a big surge. In the end, as I said, it has certainly done that, and it's well positioned to cope with now the second wave that we are all having to deal with. The mechanisms for supporting the public hospital system through the fund were firstly through the procurement of PPE. Thandi already mentioned this was the largest area of our support, approximately 900 million. We worked very closely with the Department of Health in understanding the needs and where the PPE was required. We worked very closely with Business for South Africa, which stood up a very effective procurement operation, which placed all the orders for the PPE. And it was extremely challenging, as I'm sure you're all aware, getting the right stock of the right quality at the right price at a time when every country in the world was chasing the same stocks, mainly in China, was very difficult. I think we feel very satisfied that at the end of the day, the funds deployed from the Solidarity Fund procured the right quality of equipment at good prices. There was no leakage, and the equipment reached the destinations that were required, really at a time when public sector stocks were needing to be built up, and the fund supplies created much needed bridge between the early situation and when public procurement was able to step in. The second area, aside from PPE, was the procurement of essential equipment, including ventilators. The fund has provided support to 3 provinces heavily impacted by the epidemic. That's the Eastern Cape, the Western Cape, and Gauteng. That funding has been used and is being used to procure essential equipment, for example, ICU equipment and other hospital equipment, including ventilators. In terms of ventilators, the fund supported the procurement of 200 very sophisticated so-called invasive ventilators that are used in an ICU setting, which were distributed to hospitals in the public sector. And then the fund supported the National Ventilator Project. This was a very powerful local collaboration under the leadership of the Department of Trade and Industry with other government departments and the CSIR. And in the end, the fund supported the production of 20,000 CPAP ventilators. These were made locally. These are low-tech, non-invasive ventilators used outside an ICU setting. And several thousand of these are already in use in our public hospital system, and will continue to be used both, for the duration of the COVID-19 pandemic, but also later on, they can be deployed for other uses as well. Finally, all of you will have read recently about the vaccine initiatives and the decision of our government to collaborate in the global COVAX facility, and the decision of the fund to support that participation with an initial payment of 327 million, which constitutes the down payment that the country has to make to participate in that facility. So this is due to be paid very shortly. It does mean South Africa will participate. It will secure vaccines for 10% of the population. The allocation will be decided by the government, most likely to healthcare workers and to highly vulnerable segments of the population. So, Ashraf, I'm going to hand back to you now. That brings to a close the summary of what was done in the health sector. And obviously, we can answer questions if there are such later on. Thank you very much.
Myself, right? Okay, thank you for that, Johnny. Jonathan Bloomberg, the Health Pillar Executive, reflecting on this all-important health report. I think even at this point in time, and I'm sure it's going to come up with questions from the media, which is in terms of the overall impact of the Solidarity Fund, you have to ask yourself, what would have happened if there was no Solidarity Fund? Something to think about as we get to Q&A later on. Let me then bring in Nicola Galimbic, who's the Head of Disbursements and Deployment, but as you've heard, Wendy Clow is not around because of a bereavement. In fact, she lost her father. And therefore, on her behalf, in fact, Nicola will deliver the Humanitarian Report and Behavior Change Report. I think it is a report that is as important at this time as the health issues, particularly so in the context of where we are now with regard to the pronouncements by the Minister of Health that we are in a second wave, and a lot of it has got to do with many of us as South Africans just not getting the gravity of behavior change. So, Nicola, I'll leave it to you. Thank you.
You're on mute, Nick.
Apologies, I thought that was being handled by Franco. Good morning, everybody, and it's great to be with you here today, and to have the opportunity to share some more detail on the humanitarian and behavior change efforts of the fund in its first 6 months of operation. As Gloria mentioned, I'm going to start with the humanitarian, and as she mentioned, the establishment of the fund corresponded with the implementation of the first and most intensive level 5 lockdown in the country. And it became very evident to the fund that while we were planning to address the health crisis, we had immediate humanitarian crisis that corresponded with that lockdown. And the two areas that we prioritized and continue to prioritize to respond to was that of food insecurity and gender-based violence, both of which significantly escalated during that first level 5 lockdown and have continued to be a very significant fallout of this crisis. In both the cases of food and gender-based violence, the fund recognized that these are systemic and persistent issues in South Africa. And the fund did not mean to try and address them systemically. Our role was to be an agile mechanism to respond to the immediate crisis of the surges in these areas, and to also ensure that our actions were additive and complementary to the incredible efforts that citizens, in fact, stood up to make in these areas. There was a huge mobilization of civil society organizations and of business in responding to food relief efforts at the time and to providing support in communities for victims of gender-based violence. So our job was to be additive to those. And what we soon recognized was that while there was the surge in civic activity, it tended to be in the metros, and it was unevenly distributed, and the Solidarity Fund stepped in to both scale up and address the gaps in these food relief efforts, and to support the scale up of the gender-based violence interventions. In the first phase of our food relief program, we went through a very systematic planning process, identifying the poverty wards across the country and working with a network of over 400 organizations to identify the households that were facing the most severe food insecurity crisis and to be able to provide immediate food relief to those households. We allocated 120 million rand, of which 117 had been dispersed by the end of September, and we have reached 300,000 households as was targeted in that phase of our food relief program. We also, over this period, allocated a further 100 million towards food vouchers, which I'll talk to the food parcel and voucher issues in a moment, as well as to agricultural input vouchers for those subsisting on the land in rural parts of the country. In that first phase and during the lockdown, I think we need to recall the circumstances in which the food insecurity crisis emerged. The government programs had ceased to operate. The food supply chains were completely disrupted, and food parcel delivery was essential as a means of actually delivering food to households that were in dire distress. We worked with literally hundreds of NGOs, faith-based organizations across the country, as well as with the private sector and with the Department of Social Development, in a very well orchestrated and coordinated effort to manage the food parcel delivery across the entire country, and the most remote parts of and needy parts of the country not being reached by others. We also then piloted a voucher program and have developed, I think, a very successful platform for the distribution of food vouchers to households in distress, and plan to scale that up, and have been subsequent to September implementing programs under the leadership of Wendy Claw to reach households not covered by the social net and not receiving the COVID relief grants. The agricultural input vouchers, as I said, were designed to support on a more sustainable basis the ongoing agricultural production activities of households in the most rural areas of South Africa. So I think a phenomenal effort at a national scale. I think we need to understand that food insecurity challenges remain, but I think that the fund has played a really important role in an immediate and emergency humanitarian effort that was required during the period of the lockdown in respect of food. In respect of gender-based violence, the focus was on scaling up and supporting the existing services available in communities and nationally that were experiencing a surge of demand. And this took the form, firstly, and I think, again, a sector where there are many players, a complex problem, and many different organizations involved in the sector. The Solidarity Fund was able to coordinate and collaborate with many players in the sector to identify the most significant priorities, to identify the 3 projects that we went on to support after a detailed process of consultation and extensive due diligence. And in that phase, we funded a total of 20 million rand, of which 18 has been dispersed to firstly to the national shelter movement, as well as the Thuthuzela care centers. The national shelter movement is a network of 78 shelters across the 9 provinces. The Thuthuzela care centers, led by the NPA, has 55 centers across the 9 provinces. And all of these not only had a surge of demand, but required PPE and medical equipment in order to be able to operate at that front line and support victims at that time. We were able to provide over 300,000 units of PPE to all of those centers across the country and other forms of support. In addition, we were able to scale up the Gender-Based Violence Command Center with 40 additional workstations and laptops required to be able to cope with the surge in demand that the call centers were receiving, and also scaled up a communication efforts around gender-based violence to mobilize both and support the prevention efforts as well as community support for victims. So an area of significant partnership, and I think very significant impact during this period in a scourge in our country. I'm going to shift then to the behavior change and communication campaign. I think Ashraf and others have indicated that from the very outset of the Solidarity.
We're coming out of that briefing by the Solidarity Fund. The briefing started by the chairperson of the fund, Ms. Sirobe, who was saying that she was hoping that this would be their last report, but seemingly the work of the Solidarity Fund, which is to manage and augment the work of government in the COVID-19 outbreak, is still needed. And she thanked the different board members, including Mr. Sizwe Nqasana and Ms. Trifosa Ramano, for agreeing to join the board, but also Thandin Zemande, the new CEO of the fund, thanking the work of former CEO Nomkita Ngweni in terms of how far they've come so far, but also the different deliberations about the different pillars that the fund hopes to support, but also congratulating the head of the humanitarian and behavioral change pillar, Ms. Wendy Glow, who's currently away on bereavement after the passing of her dad. Let's take you now